Peptides are more popular than ever before. They're being marketed for everything from dementia prevention to muscle repair to fat loss to even improving your skin tone. Now, there's a lot of data out there about these peptides, but none of it is solid data. So we're going to break it down. These are the top 10 peptides my patients have asked me about, or some that my patients are actually using. And I'm going to mention for each of them the best alternatives to give you very similar, if not better results. Stay tuned for the top 3 questions that my patients ask that are the common misconceptions about these peptides at the end of the video. I promise it'll be worth it. So peptides are small amino acids that get into your body either orally or injected, topical, even nasal, and they can have many different effects on the body, from acting as a hormone to binding or blocking a receptor. But the claims that they have is often a little bit more than what they can actually achieve. The current limitations we have with peptides is that they're being manufactured in labs that aren't necessarily regulated. Of course, the FDA has no regulation whatsoever. And even though third-party companies exist that will vet these productions, these third-party companies are often entities that you can just pay a bunch of money to, and they will slap a really good label on top and say, yes, we tested it and everything is fine. With peptides, the big issue is that peptides can break down. They can have a lot of impurities during the production, and the amount in each injection or topical treatment can be inconsistent. One important thing to keep in mind is that if a peptide is as effective as it's claimed, there are ways for pharmaceutical industry to get these approved through the FDA. Yes, it is expensive, but right now there is a lot of doubt whether the long-term safety of these products or even their actual effectiveness is what it's claimed to be. And for that reason, a lot of pharmaceutical companies are not going after these for patenting. I'm Dr. Rashori, family medicine physician turned health coach. So let's get to the top 10 list. Number 1 on my list is BPC-157. It is the most produced peptide, probably, and it is said, or it is claimed, to repair tendons, help you with healing after exercise, and it might even have some gut protection or gut health. It is oral and it is injectable. The biggest problem is it's manufactured by so many different entities that testing has actually shown that some of the ones that are sold online, it's not even BPC-157. So getting it from a reputable source is really important. But we only have animal data. There aren't a lot of solid data to show that this actually works. And remember, with anything, the placebo effect can be incredibly amazing. I have lots of patient stories where somebody was taking what they thought was a blood pressure medicine. In fact, it was their acid reflux medication, and their blood pressure was lower until I told them, this is your Pepcid, not your lisinopril. And immediately his blood pressure was back up and we had to prescribe him blood pressure medication. The best alternative to BPC-157 is going to be progressive rehabilitation and actually getting enough rest after you exercise. If you're having trouble with recovery, maybe you're overdoing it in the gym, maybe you're under-caloried, or maybe you're not getting enough deep sleep. So the next one I have is TB500 Thymosin beta, and it is an injectable tissue repair peptide. Now, there is some limited human data, but we don't have long-term data. So we don't know if this systemic medication, the systemic peptide going into your body is actually going to be safe long-term, and what other impurities does it carry with it. Again, this is number 2 on the list because a lot of people take this along with BPC-157. Now, as long as you are going to take such a peptide, it is still critically important that you're getting enough recovery cycles in your exercise, that you're getting progressive overload with your training. Ideally, you would not take something like this if you can get the best out of your exercise routine without ever needing a medication, a peptide, or anything else. Number 3 on the list is going to be Ipamorelin, CJC-1295, and this is injectable as well. It mostly has to do with growth hormone stimulation. In fact, in research, we already know that it will increase your growth hormone. The thing about growth hormone is it's finicky in that it can stimulate some other hormones downstream that are not favorable. Apparently in the body, it does go through very specific cycles that this Ipamorelin may not be able to mimic. So the long-term data is really missing. Now, if you are having trouble with growth hormone, one of the best things that you can do, deep sleep and getting enough resistance training. That is going to adequately stimulate your growth hormone. And there is a way for your body to self-regulate to prevent excess growth hormone production. The next one we have is MK-677. So this is an oral peptide, definitely used for muscle. Some people also use it for its growth hormone effects. Big problem with this is from the data that we have, it does increase your IGF-1. IGF-1 is a signaling molecule in increasing your risk of cancer production and possibly even increasing your risk of insulin resistance, which means maybe diabetes down the road. So a lot of people who are using this are actually going to benefit the most from some training, a lot of rest. So some training, meaning you get some good training, then you have a cycle of rest for your body to recover, and you also decrease your overall stress levels. Now that could be just getting better sleep, but it could also be some meditation. In my opinion, you're going to get a lot more from these lifestyle habits than you're going to get from this oral peptide. GLP-1 is going to be number 5 on the list. Now, of course, it's very well known. Semaglutide is a common peptide that's available. So if your goal is major weight loss, you have a major health risk, absolutely, these medications have been vetted. They are very effective. But just because one peptide like this is so effective doesn't make the other peptides effective. And this one is so effective that pharmaceutical companies, of course, have made this GLP-1 into an injectable form. And it can help with weight loss. It does seem to slightly elevate your resting heart rate. And of course, like any kind of weight loss, whether you do it with medication or with dieting, you can lose some muscle mass. So resistance training and getting enough macronutrients and micronutrients is really important. So the next one is Melanotan 2. So this one comes in a nasal, and I think it's an injectable as well. A lot of my patients use this. They have told me that they use it for preventing skin aging, which actually it's not even used for that. Obviously, it's used for tanning, increasing your skin coloration. But you can do that with progressively and slowly increasing your sun exposure, and of course, also using sun protection whenever possible, both topical and clothing. You can still get a great tan without risking skin cancer or any other type of problem. The main issue with this is that we have seen some changes in moles, whether they're getting darker or they're getting larger. Of course, this could just be a coincidence. We don't have really solid data to know, but there are alternatives available. There is another one, somebody mentioned AOD 9604. So I believe this is an injectable, and I've looked at the data and it's actually really weak. So if you're going to use such a peptide for weight loss, for fat loss, honestly, some good zone 2, zone 3 aerobic exercise, a little bit of lifting, and just shifting your calories from the simple starches over to more complex carbs can have a big impact on improving satiety and increasing your metabolism and getting rid of excess fat. There is one GHK-Cu. It actually has some decent data behind it that it could help. It's an injectable and it's a topical. So this one is specifically for improving skin tone and also helping with sagging skin, maybe some anti-aging skin protection. However, we have really good alternatives. There are over-the-counter retinols. There are prescription retinoids that are topical, very safe, that you can use, of course, along with sunscreen and avoiding excess sugar, which can drastically damage your skin. In fact, I have a great YouTube video, Skin Health, and I'll link it below in the description as well. So it's promising, but we have much better, safer options available. Number 9, Thymosin alpha 1. So this one has some theories behind it about immune therapy, maybe even preventing cancer, improving your overall immune system. I've had, unfortunately, some patients take it because they have an autoimmune disease. So you have to be really careful when you mess with your immune system, especially if you have any kind of autoimmune disease like rheumatoid arthritis, Hashimoto's, type 1 diabetes. Now, this is an injectable. And if your goal is to improve your overall immunity, there are some things like ashwagandha, like vitamin D, that could potentially help. But understanding why your immune system might be deficient, in fact, there's variable immunodeficiency syndrome. There are a few other true medical conditions that could be interfering with your immune system that you can get tested by your endocrinologist, immunologist, or even your family medicine doctor. So go down that path before you reach for any immune boosting medication or peptides. Cerebrolysin is number 10 on the list. This is the last one. And this one was claimed to decrease dementia, to improve your cognition. It's an injectable form. The data is incredibly weak, and we know that dementia is a 50% prevention. Very few things in clinical medicine have such effective ways of preventing it. It has to do with sleep, it has to do with exercise, and it has to do with blood sugar control. Those are the things that are going to protect the tissue in the brain and improve circulation and decrease your risk of dementia. The number one question I get from my patients is, are prescription drugs safer? Not necessarily. When it comes to any kind of health condition or health risk, for example, preventing dementia or improving muscle mass or repairing tissue, the most important question to ask yourself is, what is the risk or harm and what is the benefit? We know that lifestyle changes, diet, nutrition, stress, and sleep are always going to have a much bigger overall health effect than taking one single peptide or prescription medication. Number two, why hasn't the pharmaceutical industry patented these peptides? The main reason is that the data is pretty weak, actually, for most of these peptides. The people who work in peptides, who have some communication with, tell me that a lot of their clients are taking the wrong peptide for the wrong thing, but they're saying that they're getting amazing effects. So the placebo effect is so strong, and chances are the pharmaceutical industry has already figured this out. Second one, it's expensive to commercialize something. And number three, the long-term effects are still missing. So that's a lot of money that somebody would have to invest for maybe not a lot of gain. So when are peptides safe to use? This is the third question I get quite a lot. When should I consider a peptide? After you've maximized all of your lifestyle options, after you've medically ruled out that there isn't something else going on wrong with your body, like we said, any immune problems or some sort of mild cognitive impairment that could be causing dementia. Once you've done this and everything else is optimized, absolutely, you can then consider using a peptide from a reputable source and hopefully a physician that can prescribe it to you, so it comes from a compounding pharmacy where there is a lot more regulation of such a peptide. So remember, in summary, it's not about which peptide should I use for which problem. The question is, what system is missing? What buffer is lacking, and what should I fix first? And then if I don't see results, what are some evidence-based ways that I can intervene, either with a medication or with a treatment? And if that doesn't work, yes, by all means, the peptide could be an ideal last resort. Now, if you need help figuring out your situation, book a one-on-one coaching call with me. The information is in the description below, or just comment "coach" and I'll send you the information.